All right, so people first, that is our slogan, our mission, and so let's talk a little bit about what that actually means. So putting people first in our politics means that we have policies that provide opportunities for people to better themselves. It means fully funding our schools and prioritizing education so that our people have the skills that they need to keep Ohio strong in the future. It means educating our children without imposing massive amounts of debt on them. It means attracting high-quality jobs to our state, not ones that pay so little that in a full-time position you have to go onto government subsidies just to survive, especially when your CEO is earning record amounts. And it means making compassionate decisions when it comes to healthcare, so that we can treat our citizens with the respect they deserve. We have to make it clear that we want a healthcare system that includes all people, so that we can have a healthy, productive, and humane society. I grew up in a country that decided it was a human right many years ago, and the difference in the quality of life is profound. We, the richest nation in the world, we deserve these same benefits that the rest of the modern world has. And if the federal government won't step up and make this right, here in Ohio, we have the power to do it. So that brings me to my next guest speaker. We have Dr. Kathy Lambs here tonight with us. She is a primary care physician who lives and works in Dayton, and she is has been a state council member of SPAN Ohio since 2012. So SPAN Ohio stands for Single Payer Action Network. And it is a coalition of individuals and organizations working together to achieve fundamental reform of the health insurance system. And back in 2017, they introduced HB 440 onto the floor of the House, and that's a bill to provide single-payer access to every person in Ohio. So with that, Kathy is here to share her perspective. She's on the front line of the health insurance industry. So let's give her a big round of applause.
Very good group. From my neck of the woods, I love the brew pub downtown. Actually, we were one of the first member owners, my husband and I. So thank you. As Kim said, my name is Dr. Kathy Lambus. I'm a primary care physician. I live in Dayton. I work in Dayton. I'm from Dayton. And I work for a community health center. Now, Kim asked me to talk a little bit about what I see every day, because community health centers really are one of the front lines of medicine in your community, in your state, and in this country. First of all, as a member of SPAN Ohio, I would like to thank Representative Bridget Kelly, one of our co-sponsors of our bill. As she mentioned, HB 440. We have the highest number of co-signers in its history, and we are building on that every single year. And we really are grateful to candidates who are running on a single-payer platform, who know that this is a need in their communities and see it as the future of healthcare in our country. And it's just a necessity. So really, I have some stories. We talk about putting, I can't put the exact faces and names, but I'll tell you their stories and tell you what I see every day. Because this is not just like, this is just a few people, but I see this every day in my office. I might see 16 to 18 people a day, 4 days a week, being part-time. But this is every patient that I see, even though they're just a few of many. I have a couple that they work for a private organization, a large company. They get private insurance. The wife has severe asthma and COPD and needs 3 or 4 inhalers a month. Her private insurance will not pay for anything that is not generic. If it is a brand name, they will not cover it at all. The individuals, my patients, are responsible for the entire amount. Let me tell you about inhalers. They don't come generic, okay? There is no generic inhaler. It doesn't exist. I've seen the price go up from $50 for albuterol for an inhaler over the past 8 years to $150 to things like Advair, Symbicort, Spiriva, $250 for a 1-month supply. That adds up. We have to be keeping samples in our office from the beneficent pharmaceutical companies just to keep this woman out of the emergency room constantly for her breathing disorder. This is not a way to take care of people. I went to medical school so I could take care of people, not to have to keep jumping in through hoops and juggling to figure out, well, how can we get you, what medicine do we have in our cupboard today? That's not the system we need. Actually, the next gentleman came back to me. I hadn't seen him in over a year, and I'd forgotten the situation. He's a construction worker, making an hourly wage, but his company is big enough, he's able to get insurance. Private insurance, this is the American dream, right? Employer-based health care? Well, his employer-based health care requires that he pay for all of his medications upfront in full, submit his receipts to them to get paid back maybe 80%. Now, this person also has difficulties with education and learning, and this is a very complicated system. This is paperwork that requires lots of information, probably multiple pages. How do I submit this? Who do I submit it to? Maybe I don't have $500 this month to buy all my insulins up front. Because as we know, the price of insulin is skyrocketing day by day by day. And young people are dying because they're rationing their medicines because insurances won't cover it. So this gentleman, we have to figure this out. I've given him resources. I've given him samples. He says, well, I think I've got somebody who maybe can help me. But one vial of insulin sometimes costs $200, $300, $400 for one vial. And the more you take, the more you need. Fortunately, I think he's in the $400 range for how much he uses per month. Fortunately, right? This is unacceptable. I should be able to give him what he needs. That's the practice of medicine. Diagnose. Identify the problem. What is the best treatment plan? How can I help that? Not this. This is like third world medicine here. This is ridiculous. And this is in Dayton. I have to play the game with insurance companies every day. We have multiple staff whose job it is mostly just to be on the phone with your insurance company to say, what will you cover today? You told us last week you were going to cover this medicine. Now this week, patient goes to the pharmacy, or next month the patient goes to the pharmacy, you say that requires a prior authorization. We don't cover that now, we cover this one. Hours upon hours are spent, wasted administrative time, care not being administered to patients. This is not care. This is paper pushing, and it's unacceptable. But this is the system we're living in. We could cut back. Maybe this medical assistant I have, who spends all her time on the phone, could actually be, I don't know, taking care of patients for me instead of just being on the phone with your insurance company. My seniors are still in trouble too. Yes, they have Medicare, and we love Medicare, and it does great things, and it has kept seniors out of a lot of trouble. But it still has some holes in it. One of those holes that we've created ourselves is allowing private companies to set up the Advantage plans that then have formularies and work against them, and that's the donut hole. The donut hole is not what Medicare is. The donut hole is the Advantage plans. I have my seniors asking me, say, well, I usually use these types of insulins. These are the best ones that are recommended, but I'm going to be in the donut hole soon. I think we're going to have to switch to these other ones which are less effective. What choice do I have? They either have no insulin or they have something that's not as good. It's better than nothing, right? Something's better than nothing. But this is a system I have to work with to talk to patients about, not what's best for their care or how can they take care of themselves better, but, well, I guess it's better than nothing. The Medicaid expansion, yes, we need to keep fighting for that. SPAN Ohio basically is advertising or recommending a single payer plan that could be like a Medicaid for all in Ohio. We could have a single payer system in the state of Ohio that would cover, seniors. They would still have Medicare, but you could have then your Ohio healthcare plan that would be your supplement after that. And it would take care of your medications, your 20% copay, your other out-of-pocket expenses. And, when I've talked to patients who got Medicaid during the expansion, our practice had 40% uninsured patients. 40%. 35% of them got insurance, mostly through Medicaid. And I had more people coming back after a few months being on Medicaid, seeing me, getting their health in order, and they said, you know what? I got a job because I was able to get my blood pressure under control, my diabetes under control. I'm feeling so much better. You got me to that specialist who could check this other concern. Now that my health is better, I can go back to work. Now there's some people out there that will tell you that the opposite is what we need in this country and in this state, that people have to work while they're sick in order to earn and deserve health care. No, I'll tell you as a healthcare professional, and if you've ever been sick yourself, you know that the opposite is true. When you're sick, you're not going to work. So we've got to figure out how to reverse that, keep it moving forward so we can cover everybody in Ohio. My last part is just really talking about what do we define as true healthcare freedom. People talk about choice. Some people will say, well, it's being able to choose your health plan, being able to choose your insurance. I don't want that choice because I don't have it anyway. My employer chooses my insurance. I don't. So I don't have that choice. The choice I want is the choice and the freedom to choose my own doctor, to choose my own hospital, to choose my own care. What if I want to choose to go back to school or start my own business and not be fearful that someone in my family or myself might have a serious health crisis that will bankrupt us? That's the freedom that I want. And I hope that's the freedom that everybody in Ohio wants.
Thank you, Kathy. I can only imagine how many doctors are driven out of the system having to work like that. I mean, do many doctors quit because of the frustration involved?
Very high burnout. Very high burnout.
Yeah. Yeah, and when I arrived here 25 years ago, I became an employer right away because the man I married had a business. I started working with him, and yeah, we had to provide healthcare for our employees. And I was like, what? Why is that even anything to do with us? Obviously I've spent my time here and I understand it now, but yeah, that's a really unusual concept to have health insurance tied to your job. It obviously, that freedom she just spoke about prevents you from leaving the job and getting a job you actually like. A friend of mine in Bellbrook, she was the director of our local preschool. She was an amazing director, and her teenage daughter had some medical issues, and she had to leave that job and go take another job as an assistant to a kindergarten class, I think, over in the Kettering Health School District, because she didn't have the health insurance. This smaller preschool couldn't provide her with the health insurance she needed. So yeah, there's no freedom involved when it comes to an employer-sponsored healthcare package. But thank you, Kathy.